Hello and welcome to the July installment of our monthly 21st Medical Group Town Hall. I'm Colonel Patrick Pohle, joined today by my superintendent, Chief Dan Stellabotte. What we'd like to share with you today are a few items related to COVID, based on what we've seen in the media, a few announcements, and also some information on some services that we have available that we'd like to spotlight for you. With that, Chief, if you're ready,
yes, sir.
We'll go ahead and get started. The first thing I'd like to go over today are certain items that we've noticed in the media related to COVID and specifically the COVID vaccine. One is heart problems, and the second is Delta variant. If you've been watching the news at all, you've probably seen a little bit about both. But I want to know the truth versus the myth. So I went to one of my fine medical providers in our Peterson clinic, Captain Matt Noble, and he was able to pull off some information for me regarding both of those topics. And forgive me if I read a little bit. When we're talking about these heart issues, I want to make sure that I get some of these things specific and correct for you. When we're talking about heart issues, you might hear terms like myocarditis and pericarditis, okay? But what are these things? Well, what we're really talking about with myocarditis is an inflammation of the heart muscle. With pericarditis, we're talking about an inflammation of the sac that surrounds the heart. What has been found are certain cases where after the mRNA vaccine, and by the way, that includes both Pfizer and Moderna, certain young people, specifically those under the age of 30, have developed these heart inflammation problems. It looks like the number that they found were 393 cases. But let me put that in perspective. Even though that sounds very scary for folks, with folks that are between the ages of 16 and 39, it's estimated that there would be 16 cases of myocarditis or pericarditis reported for every million second doses given to people in that age group. Now here's the interesting thing about that. That works out to 0.0016%, or roughly 1 in 62,000. So that's the odds related to these particular vaccines of developing one of these heart inflammation problems. Here's the kicker though. For folks who have actually contracted COVID-19, the odds of getting something like myocarditis are between 1 and 3%. So as you can see there, the risks related to the vaccine are far, far, far less than the risks of these same problems related to COVID-19 itself. So people ask the question, should I get the vaccine? The short answer is yes. If we're talking about probabilities here, the odds of having worse outcomes from COVID-19 versus the vaccine, it's no contest at all. But what should you do if you get one of these vaccines and you develop some sort of heart problems or concerns? Well, the first thing is get it looked at. You should go to the ER. You might have to limit activity for as much as 6 months. But here's the good news. In most of the people who have developed these concerns, the concerns have been very mild and have resolved with little to no problem. The other topic that I wanted to address is the Delta variant. But what is the Delta variant? We hear about it all the time on the news. And all we're really talking about is the latest variation, the latest mutation of the virus that leads to COVID-19. Well, what we found with this latest variant is that it is much more transmissible than previous versions of the virus. So is it something to be concerned about? Absolutely, we should be concerned, because what we're finding right now is the Delta variant accounts for over 20% of cases in the United States right now. And it is especially apparent in those areas that are or under vaccinated. So then what do we do about this Delta variant? Well, we get vaccinated. That's the recommendation, because what we've also found is that a single dose of Pfizer's vaccine can reduce a person's risk of developing COVID-19 symptoms caused by the Delta variant by 33% and reduce the risk of hospitalization by 75%. With a second dose of the Pfizer vaccine, we boost protection against the Delta variant to 88%, and a fully vaccinated person is 94% less likely to be hospitalized. And that's kind of the point with these vaccines to begin with. Can they help you not contract COVID-19? Certainly. But the main point is, even if you contract COVID-19, your odds of a severe illness or hospitalization goes way down. So what would we recommend from a medical standpoint? We still recommend vaccination as the best line of defense against all the variants of COVID-19. Since we're already on the topic of COVID, I wanted to also offer a couple of announcements regarding our medical group operations related to COVID and other medical care that we provide. One of those updates has to do with the vaccines themselves. We are still actively giving out vaccines. However, the demand has lessened to such a point that on or about the 12th of July, we will be taking our vaccine operations and moving them from the gymnasium and bringing them back within our clinic. Can you still use the same scheduling tool that we've previously presented? Absolutely, and we'd be happy to present that again. The difference will be when you go to sign up for your vaccine, it will probably say location in addition to time. The other thing that I wanted to bring up has to do with access to care for all segments of our population. For those who have been involved with either these town halls or have tried to seek services through our clinic, if you're a dependent or retiree, you might have noticed that based on our manning concerns and our need to support other missions, specifically related to the vaccine, you might have noticed that we've had to take our dependent and retiree care, acute care specifically, and send that off base because we simply didn't have the capacity to provide those services on the installation. We are happy to say that we're moving back in the direction. We're getting our people back in the clinics, and therefore, through the month of July, we will begin to reincorporate dependent and retiree acute care back into our clinical operations on the installation. With that, I'd like to hand it off to Chief Stellabotte to highlight a couple of our special programs. Chief?
Yes, sir. Appreciate that. So one of the areas I'd like to highlight is the health promotions area. A lot of folks don't know where that's located. That is in the fitness center on Peterson Air Force Base. It's on the second floor. And they've come back along and put out some great programs out there. And I'd like to touch on some of those, let you know how to contact them and get scheduled for those classes. So they have Warrior Fit, Back to Running Group. It'll be a great area to get involved with now as we roll into PT tests that are ramping back up this summer. Biomechanics of running. So sometimes we get out there and run, but we don't know if we're doing it properly. They can help you with that as well. Stress-free, so day-to-day ops, sometimes stress gets ramped up. They're going to help you, give you some coping methods and also some educational tools. Sleep hygiene, right? So a lot of us, we think we're doing well with our sleep, but are we really doing that? So they'll provide members with tools on making sure they're getting proper sleep and coming in well-rested and taking care of their bodies. And then the last one that I've seen that they have on the calendar is Thriving Mind. And so if any of those are of interest to you or your airmen or your dependents, give a phone call to their clinic there at 556-4292, and they'll be able to get you scheduled, and they'll be able to answer some more of your questions if you're interested in some other programs. So, sir, can you let the audience know about our new program we have over there, which was formerly BHOP?
Thanks, Chief. I would love to talk about what was our BHOP program, but we really call it our Behavioral Health Consultant Program. What this is a mental health provider embedded within our primary care clinic. And what this offers is a way for people to access some level of mental health care by going through your primary care provider or your primary care team. What a lot of people don't realize is when it comes to pursuing some sort of mental health intervention or preventive services, probably 80% of patients actually present to their primary care team rather than directly to specialty mental health. We want to make that process as easy as possible. Dr. Lopez happens to be our behavioral health consultant at the Peterson Clinic, and she can offer a full spectrum of interventions ranging from managing anxiety, helping manage depression, to also helping manage chronic medical conditions. For example, healthy eating behaviors that might support some sort of treatment or intervention prescribed by a physician. If you want access to Dr. Lopez, how do you go about doing that? Well, you go about doing that the same way you would find access to your primary care team. For example, you can either go through our central appointing line and simply ask for a message to be placed with that team regarding the behavioral health consultant, or if you have access to your patient portal, you can send a message to your primary care team requesting that service through that venue as well.
Sir, so since you mentioned getting in touch with your PCM team, I'd like to take this time to re-emphasize the patient portal. Those familiar with the PAST portal is a very efficient tool where you can communicate with your PCM team. At the bottom of this page here, you'll see the link where you can go in, sign up for the patient portal access, and this will give you a direct link between yourself, PCM team. I have personally went into this new Genesis construct and used it to refill prescriptions. You can put in notes and ask questions to your provider team, and then we'll get back to you in a timely manner and make sure you're getting the information that you need. So we'd like to thank the audience for tuning in again. A reminder is that within this forum, you can submit your questions. We'll take those on for next month's town hall. We'll make sure we get the answers out to you. Just want to say stay healthy. Appreciate your questions in the past, and thank you for what you do. Take care of yourselves.